Hi, I'm Dr. Ethan Cowan, and I work in addiction medicine. I want to take just a few minutes to talk about fentanyl. You've probably heard the name before, but there's a lot of confusion about what it actually is, why it's so dangerous, and what really helps when someone wants to stop using. So fentanyl is a really strong opioid pain medication. Doctors use it safely for things like major surgery or cancer pain. But the problems we're seeing now is with illicit fentanyl, the stuff made illegally and sold on the street. It's often mixed into heroin, cocaine, or even fake pills that look like prescription drugs. And here's the scary part. It's incredibly potent, about 100 times stronger than morphine. That means that just a few tiny grains, an amount you might not even be able to see, can cause an overdose and stop someone's breathing. Because fentanyl is so powerful, it doesn't just affect your body in the moment, it can change the way your body and brain respond over time. And that leads us to an important distinction: dependence versus addiction. People often use those words interchangeably, but they're actually different. If you take opioids regularly, even if your doctor prescribes them, your body can get used to them. That's dependence. It just means that if you stop suddenly, you might feel pretty lousy. Things like chills, nausea, anxiety. That's a normal physical reaction. Addiction, though, is something deeper. It's a chronic medical condition that changes how the brain works. It creates this strong and overwhelming drive to keep using, even when you want to stop or even when it's harming your health and your relationships. And with fentanyl, addiction can happen really fast, sometimes in just days or weeks, because of how powerful it is. Now, here's something I really want people to know. If you or someone you care about is struggling with fentanyl, you don't have to do it alone. And there are treatments that actually work. Quitting cold turkey is not only tough, it can also be dangerous. Withdrawal from fentanyl can be intense, and the risks of relapse is high in those first days. But there are medications that can make a huge difference: methadone, buprenorphine, and naltrexone. These medications help reduce cravings, make withdrawal more manageable, and even lower the risk of overdose. And when you combine them with counseling or support, people have a much better chance at long-term recovery. So here's the big takeaway. Fentanyl is incredibly strong and can be deadly in tiny amounts. Dependence can happen quickly, and addiction is a complex medical condition, but recovery is absolutely possible. With the right treatment, including medications and support, people do get better. And if you or someone you know needs help, reach out to a doctor, a treatment center, or even start with the resources here on the Rutgers Brain Health Institute website. You're not alone, and there's real hope. Thank you.